Okay, we might make a start then. Well, good morning, everyone, and welcome to today's Breast Cancer Awareness Month webinar brought to you by BreastScreen Southeastern Sydney Illawarra. My name is Anna Cassetto, and I'm the Chief Radiographer of the BreastScreen CESI service. I would like to acknowledge the Bidjigal people who are the traditional custodians on whose lands I am on today, and I acknowledge the traditional custodians of the lands of where you are joining me from today. We pay our respects to elders past, present, and those of the future. I would also like to acknowledge and welcome any Aboriginal staff present for today's webinar. This webinar is the first in a series of 5 webinars being provided during Breast Cancer Awareness Month. All webinars in the series will be recorded and will be accessible from the BreastScreen Southeastern Sydney intranet page. Today's webinar is titled Using Mammography to Detect Breast Cancer. The program began in 1991, and since then we have seen many changes in mammography technology to assist in the early detection of breast cancer. Before I hand over to the presenter, just some housekeeping for today. We'll hold questions until the end of the presentation, and if you'd like to post your questions in the chat, please feel free to do so. Your cameras and microphones are also turned off during the webinar. Feel free to use the icon at the top of the page to post any reactions. So today I'd like to welcome Fiona Biniakos to present today's webinar on using mammography to detect breast cancer. And it's my pleasure to hand over to Fiona for today's presentation.
Good morning, everyone. Thank you for having me. So today we're going to be talking about mammography and how we use this technology to detect breast cancer. Bit of an overview of what we're going to be discussing. So we're going to look at breast cancer, the facts. We look a bit about breast anatomy. We're going to look at what Breast Cancer New South Wales provides, or what we provide as a service. We'll review a little bit of breast imaging, and then at the end we might have some time for some questions. So what are the facts surrounding breast cancer? 1 in 7 women in Australia will be diagnosed with cancer in this lifetime. More than 75% of women diagnosed with breast cancer are aged over 50. 85% of women diagnosed with breast cancer have no noticeable symptoms at the time of diagnosis. Each year, over 20,000 women and 200 men in Australia will die from breast cancer. So this is why early detection is so important. Early detection saves lives. The earlier the cancer is discovered, the greater the chances of successful treatment. So let's talk a bit about the main risks of breast cancer. First and foremost, it's being a woman. Then age comes into play. So 76% of breast cancers occur in women aged 50 to 74 years. So that's why this is the target age group of the program. Having a strong family history is also a strong risk factor for breast cancer. So women who have a family history of breast cancer are at a higher risk. And also if you've been previously diagnosed with breast cancer, the risk of reoccurrence is again higher. So delving into family history, most women who develop breast cancer do not have a family history of the disease. So this is a common misconception out in the community and something that we should strive to rectify. Your family history becomes more important in increasing, when we're talking about increasing risk of breast cancer. So looking at family history, the more blood relatives you have on the same side of the family who have had breast cancer or ovarian cancer increases your risk. The younger these relatives are when they were first diagnosed increases risk. The more closely related these relatives are to you, so that's a sister versus a cousin, for example. And if you have any family members diagnosed with breast cancer at any age, really impacts that risk factor. Now, just a bit of an overview of the female breast and the anatomy. We can see a cross-section of the female breast. You can see the nipple protruding out from the breast, and then behind that there are ducts going back towards what we call the lobes. These lobes are made up of lobules. There's about 12 to 20 sections within a lobe, and this is where milk production occurs. So around these lobes and ducts, we have adipose or fatty tissue, and within this area, within the adipose tissue, it's a network of ligaments, fibrous connective tissue, nerves, lymph vessels, lymph nodes, and blood vessels. The lymph nodes, as you can see from the front on image, they're in the green. There are fixed areas throughout the lymph system, and these act as filters by carrying abnormal cells away from the healthy tissue. So, what can we do to increase breast awareness, and what can we teach our friends and our colleagues, and how to take control of their breast health? The first and most important thing we need to do is be breast aware ourselves. You can do this at any age, and it's really important. It's a really individual thing. It's really important for you to know what is normal and what the status quo is for your breast, because that means that if there is any changes or any concerns, it's very easily identifiable by yourself. The next thing you can do is have regular checkups with your GP or your women's health nurse. And one of the third things you can do, and something that we can help you with, is have regular mammograms to diagnose breast cancer early. So Breast Screen New South Wales provides breast mammograms for free for women aged 40 and above. Really important to reiterate to our community and to ourselves, finding breast cancer early really does increase the chances of survival. So, what sort of changes are we talking about? So, when we're talking about being breast aware, what are we looking at? So, firstly, we're looking at the size and shape of your breast. If there's any changes to your status quo or what's normal for you, it's something that we want to look into. Any change to the nipple at all. So, whether that be crusting, ulceration, redness, a new inversion to the nipple, any changes from what's normal for you, we want to be looking out for that. Any sort of nipple discharge that occurs without squeezing. So this can be blood, this can be clear fluid, it can be brown, any sort of discharge, it's really important to be aware of. Any changes to your skin or the skin around the breast, such as redness, dimpling, is something that we want to be aware of. Things that we want to feel for and look for, any new lumps or lumpiness in the breast or up into the axilla, up into the armpit, or any sort of unusual pain that doesn't subside, again, in the breast or the armpit, something we really want to be aware of and raise our breast awareness about. So, what do we do here at Breast Screen New South Wales? So, we're a screening and assessment service. Our target age range is 50 to 74 years of age. However, women who are aged 40 and above are eligible to attend the service. We provide free mammograms, so breast x rays, breast screens that are used to detect breast cancer in women who have no symptoms of breast cancer. A screening mammogram can detect cancers that are really too small to be felt, and they can be as small as a grain of rice. And this is when we want to make a diagnosis, when the breast cancer is super small and it can be treated most effectively. A breast screen is recommended to have one every 2 years. You don't need a referral to attend the service. You just can call up 13 20 50 and make an appointment, or you can hop online and do that. And it's really important to know and educate everyone that we're an all-female staff here. So the people that you'll be dealing with, the people performing your examination, will be women. Why is it so important to have a breast screen? So the literature shows there is an increased chance of surviving breast cancer by having routine mammograms. So for every 1,000 women who are screening mammogram every 2 years from the age of 50 to 74, around 8 deaths are prevented. Improved early detection is so important. Screening mammogram, as I said previously, can detect very small cancers as small as a grain of rice before you or your doctor or health professional feels any symptoms. This alone means that the survival chances are much greater. Improved treatment options. So if you find a breast cancer early, it's most likely to be small and therefore more successfully treated. And it still stands that mammography remains the most effective method of detecting breast cancer early, especially in the age group of women 50 and above. They're not always 100% accurate, but they're still the most effective method. This is something that we are asked often in the screening setting. Mammograms can be uncomfortable, and women will often say to us, is there anything else I can do? I find this really uncomfortable. And this is what we say. The literature shows it is the most effective in finding early breast cancer. It is the gold standard. So, what are the limitations and risks around having a mammogram? So, the limitations are that it's not 100% effective. This is why being breast aware is so important. Knowing what's normal for you and identifying any changes early is critical in maintaining our breast health and breast awareness. A breast screen only detects existing cancer, doesn't prevent you from getting cancer in the future. Again, being mindful of our breast health and being breast aware. The risk, so if you do have a breast mammogram and an abnormality is identified or an area of interest is identified, you may be asked to return for further tests. A benefit of having a regular breast screen, and the benefit of having regular breast screens far outweighs the very small risk of exposure to radiation. So women do receive a very low level of radiation with every mammogram that they get. Breast cancer can develop between your breasts between breast screens. And again, why we need to be breast aware, even though we've had our mammogram and we're keeping to our routine every 2 years, we really still need to be aware and examine our breasts regularly, looking for any changes or anything concerning. So why are women not under 40 included in the program? So research shows that screening mammography is not effective in women under the age of 40. Younger women's breasts tend to be more glandular and more dense on X-ray, and it has been shown that starting regular screening at a younger age can be more harmful. So this is just a picture of some mammograms, and you can see the dense, with a younger woman, the denser breasts. They're very highly contrast. There's a lot of darkness and then there's a lot of white. The white is the glandular tissue. As we age, it's a very natural process that fatty replacement occurs of the breasts, so that glandular tissue reduces and more fatty tissue comes in, encompasses our breasts. And you can see that X-ray of the older women, there's not much glandular tissue left, and it's more of a grey tone in the image, and that's showing that that fatty replacement has occurred. So how do we perform a mammogram? What happens when you come into the room, into one of our mammography rooms? So we're taking 4 X-rays of the breast, usually 2 of each side, and there is compression involved. The compression lasts a few seconds. So we will do what's called the CC craniocaudal view, where we compress the breast top to bottom, 1 of each side, and then we'll do the MLO view, medial lateral oblique view, where we compress sideways. The radiographer performing the examination is always female, and we really have a strong skill set, and we're able to build a rapport with clients to make them feel comfortable and make the experience as good as we can. We're all professionally trained, and our quality and assurance is always monitored, so we're producing the best, most diagnostic images, and we can organise for interpreters when required. So this is just a picture of a CC view. You can see the lady in the mammography unit being compressed, and this is just an example of the CC. There are certain features that the radiographer will look at when they're reviewing your images in the room to make sure we have a really high quality diagnostic image. You can see the white here, this is the glandular tissue. The darkness around here is the fatty tissue, the nipple on both sides, and we're looking for symmetry there as well. This is a view of the MLO. So this is where the medial lateral oblique is taken, where the compression is done sideways. You can see the lady in the mammography machine there. Again, there are certain features that the radiographer is trained to look for to ensure this is a high quality diagnostic image. You've got the muscle coming down here. You've got the white for the glandular tissue, nipple, and then coming through down to the abdomen to ensure that we've visualized as much breast tissue as possible. So why is compression needed? Why is it so important? So it's needed in order for a clear image to be produced and also the minimum dose of radiation to be administered. So how I explain it to clients coming into the room is if we're taking an X-ray of a 3D structure and we're getting a 2D image, we really need to compress that tissue to spread out the tissue to see what's going on underneath. So I always say, imagine if you're taking a picture of your friends on your phone and they're jumping around laughing and you're trying to get some pictures. Everything would be quite fuzzy. You wouldn't be able to make out the details of their face or anything. But if they were to sit there and strike a smile and pose and you took a picture, you could see their features really clearly. So that's sort of how mammography is reflected in mammography. We need a really still image. We need a still breast, and we need to spread out that tissue as much as we can. It's not a one dose fits all. We work with our clients in order to get a good amount of compression, an acceptable diagnostic amount of compression, but we work together as a team in order for that to be achieved. So what happens after your mammogram? You'll be sent your results within 2 weeks from having your mammogram. Your images are read independently by 2 specialist doctors. And then that result is sent out to you. If during that reading process, there's an abnormality detected or an area of interest detected that they would want to investigate further, we'll contact our client so that they can return and attend what we call an assessment clinic, where we do further tests and investigations. So we can kind of break up breast screen program into sort of two sections. You've got the screening and then you've got the assessment. So if someone is called back for assessment, stay calm, don't panic. It doesn't mean you have breast cancer. What it means is an area has been identified that we want to look at more closely and investigate further. It does not mean you have breast cancer. In fact, around 90% of women who are called back for further tests do not have breast cancer, but where there is an area of interest that we've seen that we want to look at further. So how do our assessment clinics work? How are they structured? So within BreastScreen CESI, we use a triple test approach, and this includes further imaging. So at screening, you would have had a 2D mammogram. When you return to us for assessment, you'll have a 3D mammogram, as well as any other specialist views that might be required when we're looking at that region of interest. We'll take your clinical history and you'll have a breast examination by a breast surgeon. And with all that information, the radiologist will determine from there if a breast biopsy is required, how that's going to happen, and that will also happen when you attend our clinic. Clients can be very nervous and very stressed when they return, when they've been recalled for an assessment, but we have our nurse counsellors on site and our radiographers here who offer support and information and make sure our clients feel really supported and informed about what's happening during that day. So a little bit about 2D mammography versus 3D. So when you return for assessment, all women will have a 3D mammogram. And what a 3D mammogram is it takes slices through the breast at increments. So we're taking these incremental x-rays, and what we can do is we call it scroll through the images. We can look through those images and look at different slices of the breast and really localize that region of interest a little bit easier, and the radiologist can assess that region better. Other mammogram views that we can use in conjunction with 3D mammography include compression and magnification views. We might orientate the breast in a different way to create a little bit more of a bias from one side to another, again, trying to highlight that region of interest. Or we might perform what's called a lateral, which again is another orientation technique where we can see that area of interest better. Based on the region of interest and how best to see that is the views that are taken for that client. So it's quite an individualized pathway that we do for each client, so we can really tailor things to what we're looking at for that person. This is just a little bit of a graphic about tomosynthesis, so a 3D mammogram and how it works. Over here you can see a 2D, so this is one image, it's a CC image of that top-down sort of view. With 3D mammography, we take these slices through the breast and we can localize areas better. So in this 2D mammography, the radiologist said this area might look different or might have changed from previous. I want to investigate this further. So as we look through the slices of the 3D, we say, oh, on this slice, I can see this area a lot better and it's been magnified up here for us. We can see here some striations coming off of it. The radiologist with all that information on board might say, let's do an ultrasound, or I'd like to biopsy, etc. So what is the role of the radiologist within the assessment team? So they look at the images and they interpret those images, and from there they figure out how they want to proceed. What does this client need? We might do an ultrasound to further characterize that lesion or that area of interest. We might need to perform a biopsy, and from that we need to correlate that area with pathology. So they're really guiding that process, that assessment pathway for that client or that patient, and really determining on the day what tests we need, where we're going to proceed, and taking all that information on board and figuring out the plan for that client on the day. So what are the sort of things that the radiologists are looking for? Why might someone be called back to assessment? So masses, architectural distortion, asymmetric densities, and calcification. So if you look over here at the mass, obviously here we can see this round opaque mass that we want to look at further. The radiologist has reviewed it in both planes, and then from there might think, that's unusual, that wasn't there previously, let's go through and do an ultrasound. I might pause here and just talk about looking at what was there previously. So mammography really works on a basis of what is there now, what was there previously? Has there been a change? Is there something new? Is there something different? And this is how we explain it to clients who are coming to us. Having a mammogram is fantastic. It's the first step to taking care of your, breast health. But what we want to do is have this on a continuous biannual basis, because what the radiologists are doing when they look at your films, they're looking at what was there previously. And that is such a strong and important tool in determining, is this of concern? Is this area of interest? Or, no, that's been there for the last 2 years, 4 years, 6 years, whatever. I'm happy, that's stable. That's not something we need to investigate. So really important to also get that message across to people. So having one mammogram is fantastic, but also keeping up on that journey of having continuous screening mammography is important. Another thing that they're looking for is architectural distortion. So with breast imaging, there's usually a usual pattern of breast tissue, of glandular tissue, and anything that's distorting that regular pattern of glandular tissue is something that we want to look at. So over here, you can see this area that it just doesn't fit into the normal pattern of breast tissue. Off of this area, you can see what we call spicules, or these little striations coming off, again, distorting the tissue around that area. You can see it quite well in the CC here, and that's something that we would want to investigate further. Another reason to be recalled is asymmetric density. So as I said about looking at previous mammograms, we also look at each side, and they should be relatively symmetrical. Breast patterns should be symmetrical throughout both breasts. So here you can see that they've circled this area. There's kind of this like white little region of interest that is not on the other side, so it's asymmetrical, and that's a reason that we'd want to investigate that further. Over here, we've got what's called calcification. So calcification can be very normal in the breast and nothing to be worried about. Calcification can also be the early signs of breast cancer. And to determine that, our very skilled radiologists look at the pattern of calcification, look again, was it there previously? Is it there now? Is it more numerous? Is it stable? And with all that expertise, they can figure out, is this something we need to be concerned about, or is this something that we need to, that we can say, no, it's all good. Ultrasound is another tool that we use in our assessment clinic. So it acts as an adjunct to 3D mammography for the assessment of the breast. It's also used in as an initial imaging technique in pregnant and lactating women. And it also just is another tool at the disposal of the radiologist, where they can characterize lesions or areas of interest in more detail to really understand what's going on there. So you can see this is just an example of an ultrasound of a lesion here. They can use tools on the ultrasound machine to measure how large something is, how tall something is. Is it vascular? Does it have blood flow? And it helps to localize lesions as well. So with all that information, all that imaging, the radiologist has this information in front of them, and then they need to determine, what are we going to do moving forward? Is there cause for biopsy? And if there is cause for biopsy, how are we going to biopsy? So the different options for biopsy, you can do a fine needle biopsy, and they usually use that technique for cystic and small indeterminate lesions. You can do a core biopsy, and it's usually used for solid lesions that are equivocal to malignant in appearance, or you can use a vacuum-assisted core biopsy, and you can use that under ultrasound or mammogram. Again, the radiologist with their expertise and their knowledge will determine what the best pathway is for that patient and proceed on the day. Results of these biopsies are available 2 to 4 days post-biopsy. So these are just some examples of biopsies and sort of what we're looking at on the other side. So this is an X-ray image of the breast, and you can see the needle being introduced so that a sample can be taken. This is a vacuum-assisted core biopsy, and the vacuum part of that means it has the biopsy needle has a form of suction that's used to bring in that tissue and sample that tissue in that way. This is an ultrasound biopsy where a core biopsy has been taken. You can see this area of interest that they're biopsying here. This sort of white line is the needle coming into that area, and again sampling that tissue so we can be sent off to pathology and see what's going on there. So, what can you expect when coming to Breast Screen New South Wales? One-on-one treatment and an appointment with a female health professional. So, coming into that room, having that time to discuss clinical history and having your mammogram is done one-on-one and always with a female health professional in a very professional setting. You'll always have the support of our radiographers on the day of your screening. And also, if you were to be recalled to assessment, we have our radiographers, we have our nurse counsellors there, really providing that individualised support and the varying degrees of support that people may need on the day. We're looking at quality. So having your mammogram read by two independent specialist trained radiologists. We're also looking at the quality of the images that we're producing, ensuring that at the screening level, we're producing really high quality diagnostic images, and also at the assessment level, making sure that we're tailoring those images and providing the highest quality required by clients. The service is free, so breast cancer screening and the follow-up tests and potentially biopsy if required are all free. It's really quick to have a mammogram. You can be in and out in around 20 minutes. And it's also very convenient. So across New South Wales, there are 60 locations within the Breast Screen New South Wales web network. Within our network of Southeast Sydney and Illawarra, we're really well located and accessible. So we're in hospitals, shopping centre sites, individual clinics out in the community. It's very easy to access one of our sites. We're also accessible in the fact that you don't need a doctor's referral. You just call the number 13 20 50 or you make an appointment online. And we're also super helpful. So if it's time for your mammogram, we'll send you reminders, or if that time has lapsed, we'll also call you just to remind you, hey, really important to take care of yourself and your breast health. You're due for your mammogram. So thank you so much for your time today. I hope that was interesting. You got a bit of information out of it. And over to Anna.
Thank you, Fiona. That was a wonderful presentation. It really gives us an insight into the service that we provide here at Breast Screen CESI. Just a reminder, if you had any questions, pop them in the chat. We're happy to answer any questions that you may have, even later on. And just to finish up, I'd like to let everyone know about the upcoming webinars that we have. We've posted a link to the register in the chat. And if I could also ask if you could complete the post-evaluation survey, that would be very helpful. So I'll just check the chat room. We're all good. Well, thank you all for attending. It's been really great to have such a range of staff attend. And we'll see you in the next webinar. Bye for now.